People who use substances may have complex and diverse needs on their path to wellness. They often seek access to a blend of health, social, and psychosocial services, as well as support from peers, friends, and family. This means a more holistic approach of wraparound care is becoming more common in the substance use field. It includes multidisciplinary teams made up of regulated and unregulated professionals who provide comprehensive services. A team approach requires clear communication about each person's role to ensure effective collaboration, training, and coordinated care. This is where competencies can help. Competencies describe the behaviors, skills, and knowledge required to perform job functions and work effectively.
As we're integrated into care teams, we have to be able to demonstrate what are the competences that an addiction counselor has, what are their knowledge and skills, what do they bring to the care team as we wrap our services around the client.
I think it's really important to have role clarity and to understand what observable behaviors and skills people should have in order to perform their role safely.
The Canadian Centre on Substance Use and Addiction has identified technical and behavioral competencies for 7 job clusters in the substance use field. These competencies can be an effective communication tool when defining a person's role, their level of responsibility, and scope of practice, especially when circumstances change, like during a pandemic.
I manage a medical withdrawal unit, and so the team there very early on in the pandemic was redeployed and temporarily relocated because of COVID-19 related PPE shortages and staff shortages. So they were all integrated with a mental health care inpatient team that they hadn't worked with before and who didn't have much experience working with people who have substance use disorders.
CCSA competencies can be used to inform communications and education tools to help managers transition staff into new roles.
We identified the competencies needed specifically for nurses who are practicing in withdrawal management, and we did that by working with the CCSA set of competencies. I was better able to communicate the unique role of withdrawal management and the competencies that were needed at a high level for complex clients. I could also coach our intake team and clarify their shifting role as they were doing a lot of triaging. And our team members also developed education materials that were based on the competencies to inform the recipient team members about what their scope of practice was and what were the unique skill sets they were bringing to that team. So it really bridged both of those worlds.
Leadership teams can use competencies to ensure that clients are getting the right level and quality of care at the right time. For example, ensuring that specialized staff at the expert level are available to care for the most complex clients.
So we were able to achieve quite good outcomes for our higher risk clients, like someone coming into the emergency department, for example, who we knew was in withdrawal from around the clock GHB use. So we were able to have an expert addiction nurse meet them there through the use of the competency document.
When it comes to more generalized services, managers can use the CCSA competencies to identify the baseline competencies required for all staff working with people with concurrent substance use and mental health needs.
For example, a client being admitted to a psychosis unit for a psychotic episode may be in withdrawal from alcohol as well. And so being able to identify that there's a basic competency that all nurses should have, which is to identify that alcohol withdrawal. So really bridging the gap between specialized care and then the more generalist nursing competencies was a key advantage for us in using the CCSA's competency document.
Those in the substance use field are doing important and complex work. CCSA competencies can assist with that work by helping managers, team leaders, and their staff to build effective working relationships with colleagues across a range of professions. For information and updates, visit the CCSA's website section on Workforce Development Competencies.